interview you?
Yes, if you like, yes.
What's all this about then, all this...
Well, we've been campaigning about mental health services locally for the last 5 months. There have been cuts to reductions in the number of inpatient beds, and also there are plans, there are threats to our 2 local community mental health centres, Laurel House in Canterbury and Durham House in Herne Bay. And so the fact that they've reduced the beds and are reducing them further is leaving people who need them short of beds, and people are being admitted to hospital all over the place, far away from their own home. And I heard recently that people are being admitted from this area, the Canterbury Whitstable area, to Brighton because there were no beds locally. And
that's a long way to go, isn't it?
It is. And as they're reducing beds, at the same time they appear to be putting valuable community resources at threat at the same time. The Trust themselves say that there will be no cut to service, but the fact that they're closing down community mental health centres does not bode well, and we just wonder what the future of mental health is with all these cutbacks.
Could you tell me who exactly is making these cuts happen? Is it the government or is
obviously the government, but the local mental health trust is called Kent and Medway NHS and Social Care Partnership Trust, and they're a partnership between the NHS and between Kent County Council, local government, and but obviously with the government cutbacks, local authorities are making vast cuts, and also the NHS is having to make cuts as well. One of the things that KMPT, which is the trust, are wanting to get their foundation trust status, and they've been told they've got to keep within budget to get that, and they're in debt. I think that one of the problems is that they opened a new inpatient unit some years ago in Dartford, but it was what are those PPIs, PFIs, private finance initiatives? Yes, that's right. Yes. Public-private. Yeah, that's right. Yeah, and I think that causes a lot of debt. There's been quite a lot of, and I don't know other reasons why they're in debt, but that's why they want to sell off buildings
do you think is this about another agenda? You reckon a privatisation of the NHS gradually?
I mean, they've already put other. They've actually people have put in tenders for services, and locally, an organisation called Crime Reduction has won the tender for addiction services for alcohol. Although I don't think they're in the private sector, but who knows what's to come in the future. Possibility of privatisation.
Do you know of any collusion with biomedical professionals in this cutting?
No. Mostly the medical professionals I know are quite concerned about what's going on. In fact, the people that I know who work for the trust, who are on the front line, are all very concerned, but they're all worried as well because of their jobs are on the line. There's concerns about job losses in the future.
Okay. What's your name, by the way?
Oh, it's Mary.
Mary. Thank you very much, Mary. Thank you. I forgot.
Does that make sense, though? I don't know.
I'm not sure. I don't think it came out in the blue, but he did admit a couple of weeks before he was going to pound it. And there was no one, like years ago, not to pick it up. No one to pick it up. Couldn't talk about emotional problems. No.
Oh my God.
Couldn't talk about our emotions in those days.
No.
Was it George, George Pitt and was it 7?
Well, that's sort of, get on with it mentality.
That's it.
Well, I mean, you have the first, you have that during the First World War.
That's right, yeah. Shell shock.
Yeah, it wasn't recognised.
No.
Mary, probably off of these still. I'll keep.
I've been told that this petition cannot be handed over during the meeting, so just before it starts, I'd like everybody to know that as a group we've been campaigning for the last 5 months about reduction in beds to mental health services, and also about the threats to close local community mental health centres. And we've collected over 2,000 signatures here, which is not a negligible amount, and it does show that people are concerned. So I'm not going to hand this over during the meeting, I'm handing it over before the meeting.
Thank you very much for that. It's good to hear an applause before I open my mouth. Anyway, welcome to Canterbury Court Precincts of Canterbury Cathedral on this glorious late summer, early autumn day. I'd like to extend a warm welcome to all of you. We've got a goodly number, so I'm encouraged that we're going to have a very rich evening. Now, before we get on to the proceedings of the AGM, we have to deal with one or two housekeeping matters. The first thing is,
sorry, sir,
just checking your pocket if your mobile phone is off.
What's wrong with that?
Because
Last time I stood on this
haven't
stage, I
authorised
said
it,
that
it's a public meeting, but
just after my
we haven't
wife
authorised
asked
any
me to
photography
say,
of the whole
remember
meeting,
to
so
bring
can
a
I
pint
ask
of
you
milk home.
Is it really odd of you? What happened to
But
the...
it's our meeting rules that we don't allow
Secondly,
photography of all of our meetings.
I'm advised
All your
no
meetings?
planned
So if you
What shall I do?
for this evening. So if you hear a fire alarm,
Eh?
the exit doors are at the back of
What will happen if I carry on recording?
I would have to ask you to leave,
You have to ask me to leave.
and I'm sure, we
Now
don't
we have a
need to
full
stay
agenda
and listen to the meeting, and
this
it would be good if
evening.
you
I want to give everyone a chance to contribute to the meeting.
kind of thing.
Eh?
there may be
But this is a public meeting though, isn't it?
It's public.
Huh?
It's the trust's public meeting.
Trust public meeting. Mental health.
we have a brief discussion about this outside now, so that we can at least allow the meeting to continue without interrupting.
Okay, can I record you then?
There's no need to. If you don't stop now, I'm going to have to ask security to ask you to leave.
So keep
Okay.
this to the end.